lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today's really special. We're talking about eye exercises and do they work? Well, the short answer is no. The ones that are out there don't really work. But also, yes, there are exercises that we really frequently use as orthoptists that work wonders. So please do stick around to the end of the video to find out which ones do and which ones don't. I hope you enjoyed the video. So this is really special because, I don't know, I just feel like I get this at least once a week in clinic. So let's start with a little bit of history. So once upon a time, about a century ago, there was this funny ophthalmologist called William Horatio Bates. So Bates came up with this miracle of miracles, fixes blindness, fixes your need for glasses, all the things, magic stuff. Basically a series of exercises that, you know, is the it-all and be-all of all things. And to this day, any kind of exercise program that I've ever seen, and I've heavily Googled for this video and researched and gone to, not just Google, but gone beyond and asked around and all that sort of stuff, I found that one way or another, loosely or much more closely, the Bates method comes up. So Bates has never really proven to work. It doesn't really significantly improve vision or do anything long lasting. So not dangerous, but also not that great. The other thing is, one thing that does come up in the original Bates program is a term called sunning, basically just standing out in the sun and baking your eyes. Bad. Don't do it. Always wear sunglasses. Do not bake your eyes. 10% of cancers are eye cancers. Don't do it. Not good. So yeah, very silly. The other one is palming. So literally palming your eyes, but putting pressure with the palm of your hand. Oh my goodness. Yeah, okay, maybe a gentle massage is really clever for several different things. It renews mucus excretion, it circulates, you know, things that have perhaps become congested. Might be good for temporary pressure reduction. There is such an idea of the massage effect when we're measuring pressures, that you don't want to re-measure too many times because you will gradually get a reduction, but it's not a real reduction, it's a massage. There is all these things, but it could also cause an increase. It could also cause damage. And if you press hard enough, you could pop something, you could block something, you could cause irritation, you could definitely cause an infection. There are so many things that could go critically wrong by palming, by literally doing that. I actually had a patient many years ago when I was pretty new do that right in front of me and said, no, I don't take my medication. I'm not going blind because I'm not taking my medication. I just haven't been doing my meditation this past week. That's what did it. You know, there's lots of theories out there, but I can tell you from a medical point of view and from it's been clinically proven point of view, and people do go blind when they don't follow instructions. If you don't take the medication that's prescribed to you by your ophthalmologist, you're probably not going to end up doing too well. And sticking the heel of your palm into your eye socket isn't going to fix something that is otherwise chemically induced by the body. So things like glaucoma, for example, would be a big one. Other programs I've been told about actually is part of the thing is to do these personal affirmations. Like, so you basically have to convince yourself that you feel your vision improving. Like you might say to yourself, I'm seeing better each day, or I can see without my glasses or contacts. Okay, if you have such a strong mind where it's like the Matrix and you can bend the spoon, I am behind you. I am so behind you. You do that. You bend that spoon. You believe that you can see and see, but please don't drive a car if your license says wear spectacles without spectacles. That's all I ask. Everything else, by all means, do you. I'm a big believer of you do you. Whatever somebody wants to practice, I'm very much supportive of that practice, as long as it's safe for others, and as long as it's not going to cause any long-term irreversible effects. So by all means. The other thing that you've got to really look out for is a lot of these exercises claim that they can reverse presbyopia, which is the natural aging of the eye. And it's not just the muscles of the eye that become weaker. They do, but that's not the real major reason for presbyopia or age-related need for reading glasses. The real reason is that the lens inside our eye naturally creates new fibers every single day from the moment it's created, which is about 7 weeks of gestation. Those fibers eventually run out of places to go. And that eventually becomes a clump, looks a little bit like a geode or a bit of a mineral or something, like an amethyst or something like that. It's got these like spokes, or like, you know, things hanging off a cave ceiling. Like that's got this like bursting kind of effect. And that will eventually cause fogging and distortion and glare, and we call that cataract. But the reality is it's just a fogging, it's just a clumping of those fibers that have been growing there since before we were born. So those fibers, before they become clumpy and cause us vision loss when we're 60, 70, 80, they initially just harden the lens, making what muscle strength we have kind of dysfunctional or not enough to bend and focus the lens any longer. So no amount of exercising those muscles is going to strengthen them to the point where they can bend something that's become inflexible. So definitely don't throw your glasses away if you've embarked on such a program. None of these things are necessarily harmful as long as you're not trying to reverse something that can only be fixed medically. Like, for example, glaucoma is my biggest one I'm concerned about always. Don't drive without your glasses if you've been told to drive in them, no matter what you think you can see. If you've been told you should be driving in glasses, you should be driving in glasses. Everything else I'm not particularly worried about, to be honest. As I said, do what's comfortable for you. Do what's the most appropriate thing for you. Because the one thing as a clinician I have come to learn is that, with all respect to my patients, and I'm really lucky, I work in a really sort of cushy environment. It's a small private clinic, so you don't get that much sort of... It's not like I work in a giant hospital where we have inpatients that we come and see and things like that. These are private citizens that choose to come and see us and do it at a fee. It's definitely not paid for. So, to get a certain type of crowd with that. And although not all people understand medicine or want to understand medicine or can be spoken to in medical jargon or can be spoken to about anatomy or anything like that, they typically will comply. Not everyone. We've had some really bad tragedies because of compliance issues, but where people have gone blind because they've just postponed their appointments, and they've come back and it's just too late. And that didn't teach them the lesson, so they've done it again with the other eye, and they've eventually lost vision into both eyes. That happened just recently with one lady where we called her and we reminded her and we asked her to come back, and we asked her if she's taking her medicine. She said, I'm just not feeling up to it, And we contacted her referrer and we said, look, we're really worried about her and all the things. And until she noticed the vision loss, which was, by which point legally blind, she didn't come back. So it's really, really, really sad that sometimes it's just you can't reach everyone. But yeah, she also was trying exercises and herbs and things like that, which probably have merit, but not in the kind of access that we have to them. And they're definitely not researched, and they're definitely not prescribed in an effective way with what we have available to us today in terms of knowledge and research. But the one really fabulous thing that did pop up during my Googling was that probably the third or so link was this. Orthoptics, we're on Google, yay! When I was studying, one of my first assignments was what is an orthoptist, and we had to describe our positions, our profession, because sometimes we only knew one aspect to a very vast profession, especially here in Australia. There's really no bounds to what we can do within eye therapy space, and it was really difficult to find credible sources on what an orthoptist is, whereas nowadays, look at that, all I had to do was click in eye exercises, do they work, and that was one of the first things that Google spat out back at me. So I'm really, really happy about that. So we do definitely use eye exercises in eye therapy or in orthoptics, 100%, especially for certain conditions, things like nystagmus, which is when the eyes sort of jiggle or wiggle or jolt around. So they're sort of like, it's like watching train tracks, which is a normal nystagmus we all have. But some people have it to the point where they can't control it, and they're often born with it. And there's definitely eye exercises that we can prescribe to teach that patient to minimize their jiggle, because all of them will have a null point or a position of best vision, and there are certain exercises that will attain that point more easily. Same thing goes for squints, so cross-eyed, or if an eye is wandering out, there are ways to strengthen the muscles through particular, very, very specifically to that patient prescribed exercises to try and achieve whatever counter to the weak muscle that they have. It has to be diagnosed though. So it has to be something like in childhood where it's congenital, or it has to be something that we understand the diagnostic etiology, because we could always be making it worse through these exercises too, which is why it's always important to have them prescribed to you rather than self-prescribe. Because quite often, even clinically, I've seen the wrong exercises prescribed and it made things a lot worse, and it ended up in Probably the surgery would have happened anyway, but Bruce brought the surgery on a lot earlier in the picture. So what was designed to delay surgery, the exercise ended up bringing it forward quite significantly and dramatically. And sometimes the eye muscles just cannot handle the extra burden of exercises, even though these exercises are very light. Sometimes just, giving extra work or extra focus to the muscles just gives them that extra little jolt where it'll disconnect altogether. That has also happened in front of me. You can kind of degrade a muscle too through exercise. That is also something that can happen. So anyway, just something to keep in mind before you sort of self-diagnose or self-prescribe exercises, because they can be a little bit counterintuitive sometimes. And in those cases, it's really hard to tell, even as a clinician, that they're going to be counterintuitive. You really just have to sit and measure and see what happens. And if you get any kind of hint that things aren't going to go the way you intend, you just don't prescribe it. Whereas you can't measure your own self. I can't measure myself. I've been doing this for 11 years professionally and 3 years before that as a student. And 8 years before I graduated, I worked in an eye space as well. So, and I can't diagnose myself. No way. I know what I have, but I can't see it in the mirror or anything. I have to have somebody else measure it for me. So that's just one of those things. The other place that we see it is in lazy eye and in dyslexia. There's definitely behavioral optometry that uses certain lenses and certain eye exercises to improve mental focus, which is very, very exciting. And I've seen a lot of promising results with that. So I really love that exists. That's really, really cool. And again, I don't personally practice it. I haven't personally trained in it, but I have prescribed prisms for people to improve their comfort. So it would have to be an ophthalmology practice that actually specializes in strabismus or in behavioral vision issues, so behavioral optometry, in order to be able to really confidently prescribe something like that. Although all optometrists and all orthoptists are trained generally in how to do these things. So tips, what is actually good for your eyes? Proven good for your eyes. I got my mascara, I can tell you. So wear your prescription. Definitely wear your prescription. There is no exercise out there that will ever replace a pair of glasses. If you don't want to wear glasses, wear contacts if they're suitable. If you don't want to wear contacts during the day, you might be suitable for something like Ortho-K, which is where you reshape the eye overnight and then you wake up the next day and the eye stays in an appropriate vision shape. That might be something you're eligible for and you want to explore. There are definitely options out there, maybe LASIK surgery, although I don't personally like it. It's a really cool surgery. There are definitely options, definitely, but not palming or baking your eye in the sun. Eat a nutrient-rich diet. I've said this 1,000 times already on this channel, and I've probably said it 1,000,000 in life. Vitamin A is super important. Yes, carrots are good for your eyes. Antioxidant-rich diet, really, really important. Your greens are extremely, extremely, extremely beneficial. Omega-3s, really, really special. Deep sea fish, or if you don't like fish, nuts, avocados, seeds, all contain really high omega-3s. You can also get them in capsule form, so you don't have to ever taste it. You can just have it as a supplement. That's also an option. Wear sun protection. Wear sun protection. I don't care where you are around the world. I don't care what the weather is. Wear sun protection. Clear glasses, clear optical glasses will provide sun protection. Any kind of filter between you and the big star in the sky will give you some UVA, UVB protection. If you want broader spectrum, obviously you have polarized or dark glasses. Never ever go anywhere near a cigarette, and if you have been a smoker, please quit. Cigarettes are a huge detriment to the eyes. I see people every single day who tell me they wish they never smoked because now they're blind. I really wish I could go and take people's cigarettes out of their mouth. If that's your choice and you know what you're doing and you're willing to take the risk, like I said, you do you. I'm never going to tell anyone how to live. I just will tell you that you will regret that cigarette one day. If you don't regret it now, you'll regret it one day. And I've never known anyone who has smoked and come to my clinic and gone, yeah, it's the best thing I've ever done. I had a lady just yesterday who said, who quit because her husband got lung cancer. She didn't quit because she got a grandbaby. She didn't quit because of her own severe health issues. But when her husband got diagnosed with lung cancer, they both just quit. So sometimes that's what it takes, and that's fine. I wish you didn't have to take that, though. I wish it was easier. And I understand that it's an addiction, but yeah, smoking is the enemy. Fragrances, we don't know that much about fragrances, but I would suggest that fragrances aren't that great for our eyes as well. I'm not entirely sure how yet, but the research has not been done, but I think one day we'll find out that all the phthalates that are around us are not great as well. Know your genes. My next tip is to know your genes. I know my genes, and I still do the next tip, which is get your health checked every 2 years. Get a comprehensive dilated eye test by a health professional. It can be an optometrist, it can be an ophthalmologist. Somebody's got to be looking at the vessels and the nerves and the periphery of your retina at least every 2 years. If everything's okay otherwise, more often if it's not, but then they'll guide you. And get bloods done. Get your family doctor, your general practitioner to do just a general blood test every few years, 2-3 years if everything's normal, if you're feeling good. Doesn't have to be too often, but get it done. You'll never know if your thyroid's going crazy until it does. You'll never know if your cholesterol's going up until it has. Some things are just asymptomatic, and the only way you'll know is if you go looking for it. It's better to know because there are plenty of preventions. There are so many preventions available, but there's not that many cures, unfortunately. So, it's a lot easier to know early in the piece than to try and chase the tail once it's wagging. Now that I've discredited all the exercises at the beginning of the video, I can very comfortably tell you my favorite 5. So these are things I constantly, regularly, frequently recommend to patients, to real life paying customers, patients. My favorite, most common one of all that I recommend is the 20-20-20 rule. And that is that every 20 minutes, for 20 seconds, you look 20 feet away or 6 meters. So you know the 20-20 vision? So we measure vision at 20 feet, which is where the 20-20 term comes from. So 6 meters away, 6'6" in Australia is the measurement. So every 20 minutes, if you're sitting at a computer or you're doing some intensive near work, say you're a student and you're trying to highlight something in a textbook, something like that, every 20 minutes, which could be, let's say you say to yourself, every 6 pages. Or if you're on the computer, you'll have a clock there. But if you don't know, just every time you switch activities or switch web pages, whatever you might be doing, if there's some kind of pause in what you're doing, when you get to that pause, just for 20 seconds, literally look as far away as possible. Out a window would be ideal, but across the room if you don't have a window, and just count to 20 in your head. That's all that really needs to happen. It doesn't have to be a perfect break. My next really love one that I love is the figure 8. And it's not a bachata figure 8. It's when you look at the furthest point you have available. Same thing, can be out the window, can be just along the floor, as long as it's just far away enough where it feels a bit like oblivion. You're not really focusing at that point. And you do a figure 8 with your eyes. You can do it on the wall like I am now. You can do it on the floor. The floor's probably a bit more challenging, so you can probably do it on the floor. But the wall's fine too. Or even just in space. On the ceiling, wherever you have somewhere where you can kind of look at but not really focus on, and you just do those exercises. It just releases the focusing tension that we tend to do when we're, the closer you look at something, the more cross-eyed you become, to just release that pull, that tension from those muscles. Which brings me to the next one, the pencil push-up test. So you take any kind of pencil, this is a brush, but and what you do is you hold it at arm's length. And you situate it right between your eyes. So my camera's at an angle, so this is right between my eyes. And very slowly you keep focusing on the tip of the pencil, and you keep focusing. And if you're watching my eyes right now, they are crossing because I am converging. I'm bringing my muscles closer together. Keep it in focus, and as soon as you lose focus, you start again. And you just gradually pull it in. And what you'll find is that you should be able to focus a bit closer every time. You can do the same thing with some tiny writing, for example. If you find a word to focus on, I'm looking at the word tested. This is definitely more challenging because reading is way harder than just looking at a stick. So that's pencil push-up. The other one I really like is eye movements. And I do eye movements in a kind of letter H. So you go to the side, up, down. You go to the middle, up, down. You go to the side, up, down. Back to the middle, up, down. What it does is it just takes you out of whatever routine you're in and keeps those muscles a little bit more relaxed and moving and things like that. A bit like having a stretch. My last and one of my absolute favorites as well, this is something I do a lot, especially for people who complain that they lose their focus after a while, so the screen's getting blurry. Of course, eye drops, because most likely it's dryness, but having used eye drops, what you do is you get 2 similar objects. So it can be 2 pens that look alike. These are 2 brushes out of the same set. You take one as far as it'll go. You take the other one as close as you can focus, and you switch. And each time, bringing the one that you're looking at into focus. And as you can see, my eyes are going from relaxed to converged, relaxed to converged. And what that does again is it just really creates strength in those middle muscles, which are really short and fat and like little biceps of the eye. They're really like, and they do a lot of work, which is why they're like that. Because our world is a whole bunch of bringing the eyes in all the time. So, you know, having a bit of something to stretch them out, relax them, it's a bit like having a stretch for your back as well, which is something you might want to do at the end of your exercises, which is really good for your postural muscles too. All right, my lovelies, this is a little bit of a longer video because there was just so much to tell you and so much to go through, and the research was about, about 13 pages long, just here on my laptop in front of me, because I couldn't possibly memorize it all like I normally do, so I had to have notes. I hope this was useful. This is something that's come up a lot. I've been asked on my Instagram many times about eye exercises, and this time I was asked by one of you beautiful followers, so I just couldn't ignore it any further, and I bumped up my schedule a little bit and slotted this one in because I feel like it's been a really commonplace question, more than usual, clinically, and then now also online. I just thought, no, I think that everyone's just feeling it with the lockdowns. I don't know if you've heard, but Melbourne, we are in our 4th lockdown. We are all frustrated, we're all over it, we're all annoyed, but we're getting through it, and we're hoping that this one will be cleaned up nice and quick and we can be back to our normal free selves. I hope that you do get a chance to jump on Instagram and see about all the different things that are going on, including where this jewellery came from. It's very, very pretty. So more on Instagram about that, and there will be a link below as well. Haven't subscribed? Why? What are you waiting for? Go ahead, click that big red subscribe button and join the family. We're small, so if there's any questions, I'm really quick to get back to you. A lot of people have chosen to privately message me. Some people have publicly messaged me. Either's fine. I always respond if I see it. If I miss it, just ask again because I just honestly missed it. So please, please feel welcome to join. Wherever you are around the world, my lovelies, I hope you're staying safe and you have not been locked down for the 4th time and you're just feeling happy and positive, and I can't wait to see you on the next one. Bye.